Hi, I'm Talvinder Gill. I'm colorectal surgeon in North-East Hospital. This is in the northeast of England, near Newcastle. My practice is mainly advanced laparoscopic surgery, single port laparoscopic colorectal surgery. So J-pouch or ileal pouch is surgery for patients who had colon and rectum removed for some reason, and they want to have bowel continuity. So rather than permanent stoma, they can have pouch made from the small bowel, which is joined to the anal canal. And it's ileal pouch surgery. It's called J pouch because of the shape of the pouch we make is the J shaped. So this operation is a major operation and is done to avoid permanent stoma. So it's a quality of life surgery. So patient should be younger and fit to have major surgery, and is done for those who had colon rectum removed, and indications for those, or most of this type of surgery is done for patients with ulcerative colitis who had colectomy and rectum removed. And other common reasons are polyp syndromes, or those who have chances of having cancer in those polyps, and they get prophylactic surgery to remove colon and rectum. They are also suitable for that. There are other type of colitis as well, apart from Crohn's. Crohn's, there are more risk of complications, so we tend to avoid. But indeterminate colitis, ischemic colitis, for any reason, if somebody had colon and rectum removed, they can be suitable as long as they are fit to have major operation. So permanent ileostomy is done once colon rectum removed, but J-pouch surgery is restoration of back to normal continuity. That means it's additional quality of life surgery. So there are risk and complications with both. If it's a permanent stoma, they can have long-term stoma-related problems. And the main problem is those patients who don't like stoma, they want to have a normal bowel continuity, they can have J-pouch or ileal pouch surgery. So in comparison, is additional operation has got additional risk and complications, but those who want that, for them, it's a significant improvement in quality of life, and especially for younger patients, it's a good option for them. It is a major surgery, and inside is, if it's done to remove colon and rectum and then make pouch as a one procedure, is quite big surgery. But those who had colon already removed, then we do remove rectum and make a J pouch. There are potential complications, but in the past used to do as an open procedure, which means big cut in the abdomen, risk of incisional hernias, adhesions afterwards, immediate post-op, lot of pain. But with advance in laparoscopic surgery, it can be done keyhole laparoscopic, or in my practice, it is single incision laparoscopic, in which way it is done through the stoma side. So no other incision or hole. So just from the stoma side, we do operation. So I think access has made it a big difference, that which was considered to be very major surgery. Now it's can be done as a keyhole, especially with advanced keyhole through single port. And these patients stay in the hospital from 3 to 4 days and recover a lot quicker than compared to what it's used to be with open surgery. So if you mean how much time it takes to do operation, so actual pouch operation doesn't take much. So main time is taken to remove the colon and rectum. Procedure can vary depending on if it's done as a single procedure, whole colon rectum removing, making pouch and anastomosis, or sometimes it's done as a staged procedure. Colon is removed as an emergency procedure before, and now we're doing removing rectum and making pouch and joining. So it depends, time depends how we are doing and what stages we are performing that procedure. So it can vary from 2 hours to 5-6 hours. Ileal pouch can has its problem or complications. In literature, we have seen that overall about 10% of the pouches fail due to various reasons, and they need to come out, and then patient end up having permanent ileostomy. So 90% of the cases you can say is permanent. Well, there are some long-term, after 10 years, some patients will go. So I think depending on what indication the surgery is being done, if it's for polyposis or non-colitic patients, chances of pouch surviving are very high, so 90 to 100%. If it's done for ulcerative colitis, it's about 90%. But if it's done for indeterminate colitis, or there's a component of Crohn's, then the pouch surviving more than 10 years comes down to 70%. So it varies that what indication we are using this pouch for, and it can vary from 70 to 80% to 100% permanency of the pouch.